Hi, my name is Maythu, and today I'll be discussing about Week 7's discussion post on a case about Mr. Jones, who is a 69-year-old that was admitted to the hospital 10 days earlier with a diagnosis of acute diverticulitis. He was given intravenous fluids and empiric antibiotic coverage with ceftriaxone and metronidazole. His antibiotics were stopped after 7 days, and then he continued to do well until today when he developed abdominal pain, fever, and diarrhea. And a diagnosis of C. diff colitis was made and antibiotic treatment was initiated. Regarding this case, I'll be discussing 3 questions. The first one is what diagnostic test will confirm the diagnostic? So C. diff produces diseases by secreting toxins, and testing usually is performed to detect toxins present in the stool. So a stool test will confirm the diagnostic. The second question is what factors did Mr. Jones have to acquire C. diff infection? One of the risk factors could be that he may have previous infection with C. diff, or the most common reason most patients have C. diff colitis is a prior history of consuming antibiotics either when the disease started or in the past 10 weeks prior. So, which he did. He was taking antibiotics for 7 days before he was diagnosed with C. diff colitis. So that is probably one of the main risk factors that made him acquire C. diff infection. The main reason prior consumption of antibiotic makes a huge factor is usually when we consume antibiotics, it alters our GI tract, our normal GI tract, normal flora. So it allows these organisms such as C. diff to move in and take up residence. So, and also Mr. Jones is also in the hospital, and it is also one of the most common healthcare associated infections. So that could have also been one of the risk factors. The third and last question is why is oral but not intravenous vancomycin a potential treatment option for this infection? So intravenous vancomycin is a potential treatment, not a potential treatment for this infection because taken intravenously will not secrete into the colon, and you need it to, the C. diff is like in the colon, so you will need to take it orally in order to kill the bacteria. So that is the reason why intravenous is not an option, but an oral one is. And that will be it for this case. Thank you so much.